to Hi everybody, and welcome to our webinar this morning. I'm really pleased to be here. Today I'm going to go through a PowerPoint of questions that are sort of the frequently asked questions and that many nurses requested that we answer. So I'm just going to jump to my PowerPoint. And first of all, I want to welcome everybody to our presentation. We have nurses today from across 17 countries. Let me just start my slideshow. So 17 countries, that's amazing. So we have nurses here from all the countries that I've listed there below. And I'm really pleased to have all of you here. So the first question was, how long does the relocation take? The short answer is 8 to 18 months. And if I elaborate, it is broken down in 6 steps. Step number 1 is the longest part of the process. That is your NMC registration. I want to keep the presentation today short, and we can also talk about the presentation or about the NMC process a little bit later, but I've dotted down the steps of the process. So your NMC, the part that the biggest challenge is obviously getting your English requirements, doing your IELTS or your occupational English. And once you have that, the NMC have actually speeded up the process quite a bit. The other thing under the NMC registration is also the council verification, which can sometimes take also about 2 to 6 weeks. And that is your nursing council that have to verify that you are a nurse. So in summary, I would say step 1, you look at a period of about 3-4 months that it will take to get that NMC registration. And you can, and most employers now, because there's a lot of nurses in the market, will only do the interview once you have passed your CBT test. So years ago or last year even, many employers were happy to interview nurses who just started the process. But unfortunately now, because there's a lot of applicants, they will only want to interview nurses who's already passed the CBT. So step 2 is the interview and the job offer. It's hard to tell you exactly how long you'll wait for an interview because it obviously depends on your experience. If you already have more than a year experience, it is much quicker to get you job opportunities. Most employers do like nurses to have some kind of experience. And if you don't have experience, it's not impossible to get a job, but it might just take a little bit longer. So while you are waiting, it is important, if you just qualified, it is important to make sure, even if you just do volunteer work, make sure that you keep adding new things to your CV and let us know about that. So job offers and opportunities, you can work for 3 different, you would have 3 different options. One is the NHS, which is our government hospitals. The other one is private. And then the last one is care homes. Now, care homes in the UK actually pay the highest. They pay higher than the NHS and the private hospitals. And the reason for that is because it's called nursing homes. And it's really the most autonomous that a nurse would work here in the UK. Unlike in a hospital where you have doctors and the extended healthcare professional team around you, in the nursing home, you are the most senior person. You would have a team of care assistants that you will be managing on a day-to-day basis, and you take responsibility for all the nursing diagnosis and also for deciding when to refer your patients to GPs or hospitals. So it is a job that pays the highest. The NHS, you get a lot of development opportunities, and they've got very specialized units. The NHS salaries will be between 23 and 28,000. Private hospitals, you most probably looking at about 26 to 28,000, although you do sometimes see salaries higher than that in the private hospitals. And in care homes, you are looking at a salary 28 to 36,000. So that is your options. And it all depends, again, about what you are looking for. If you are a specialist theatre nurse, stick to your field, because you can always develop here working in a theatre. If you are a general adult nurse, then definitely consider the nursing home sector. There's a lot of opportunities in the nursing home sector, and it is actually a job where you really step into management and providing care, where you make all the decisions and create all the care plans. Step 3, after you had your interview, the employer would expect you to complete the pre-employment checks. You will also hear my team talking about the compliance. So that is the criteria that you need to meet in order to get your employment contract. In many cases, employers will give you an initial provisional offer after your interview. And then once you are ready to travel and you've completed all your paperwork and they've looked at your references and at your application forms, they will decide in which unit you're going to work and in which of their care homes or in which of the private hospitals. So often the recruitment happens on a head office level, and it's only after you complete your pre-employment checks that you will get your allocation, where they will tell you where you're going to work. So the allocations is depending on vacancies, and it is important that you bear in mind employers can only offer jobs to overseas nurses where they have proven to the UK government that they were not able to find a local nurse, a local British nurse. So it's called the resident labour market test, and the process involves that the vacancy needs to be advertised, and that the employer then needs to provide evidence to Home Office to say that they were unable to find a nurse from the area to apply. So you would find that we often have vacancies in parts, or that we cannot always, shall I put it like that, we cannot always put you exactly where you want to be. So if you, for instance, want to be placed in Surrey, it will depend whether the employer have managed to prove the labour market test in Surrey. We often find that in the south there's less vacancies than in the north, and it's also a regional, and this changed from time to time. Last year we had a huge shortage of nurses in Northern Ireland, and I think we filled all the vacancies there. This year we don't have that many opportunities in Northern Ireland. We've got more opportunities maybe in the northwest, quite a lot of opportunities in Scotland and in Wales, and a few opportunities also in certain parts of the south of England. So there's a lot that needs to happen before the employer can give you your allocation. So that's also why that process, step 4, can easily take about 4 to 8 weeks. So you can sometimes wait as long as 2 months for your allocation. And now I'm talking pre-COVID times. COVID, unfortunately, has also created a lot of delays with these things. And the reason for that is we've got obviously a backlog of nurses that were already ready to travel in March, and they now need to travel first before they can allocate more nurses to come. So the sponsorship certificate and the visa is step 5. And that's actually one of the shorter steps. So that once you've got your allocation and you are happy with the place that they are allocating you to, you give us the thumbs up, you sign your employment contract, and the employer will then issue your certificate of sponsorship. At this stage, they should have already completed the resident labour market test, so they know they've got a certificate of sponsorship to assign to you. Sometimes it happens that employers are waiting and that there's a little bit of a delay with Home Office. We will just keep you posted on that, but generally speaking, step 5, you're looking at about 4 to 6 weeks. So step 5 is not one of the longest steps. And step 6 is easy. The visa, once you've gone for your visa application, you wait about 10 days to get your passport back, and then you are ready to pack your bags and travel. So my next slide is cost of living in the UK. Expensive. So the cost of living in the UK is, it is really not a cheap country. You will see there on my slide, we are the 11th most expensive country in the world. So there's a few countries we are cheaper. We are cheaper than Ireland, which is interesting, Switzerland, Denmark, Luxembourg, Singapore. We're cheaper than Hong Kong. We're cheaper than Bermuda and the Cayman Islands. But we are a lot more expensive than most of the places where you guys are coming from. So I've got the percentages there. But before you fall off your chair with those high percentages, bear in mind that it is relative. So if it's 276% more than the cost of living in Pakistan, you can expect to earn about 276% higher salary than what you would earn in Pakistan. So I've given the percentages there for you, but it's very relative, of course. So the average cost of living here on this slide, these are averages. It obviously differs a little bit. I did put there it's outside of London, because living in London can cost about 51% more than any other part of the UK. So the closer that you live to London, the more expensive it is. Again, it's relative because the salaries in London is also higher, and in the south, closer to London, there is an additional earning potential. So you would earn higher the closer that you live to London. But on general average, you can look at this number, rent about 550. This is not for families. This is single prices for a single person. Council tax, utilities, 100, 160. Your transport depends whether you need to travel by bus or whether you are lucky that you can walk to work, then you don't have that expense. The public transport in the UK is really good, but it's also not impossible for you to get a car when you arrive here. Cars in the UK are quite low cost, and it's definitely very affordable for people. The mobile phones is really good. The price of £40 there is mobile phones where you have complete internet, so that is unlimited data on your phone for £40. So mobile phones are not that expensive. If you bring your phone from home, you will just be able to get a SIM card, and we recently haven't had any nurses struggling with that. So do bring your phone from home. Once you are settled and you've got a bank account, you can also take out a contract and get a nice upgraded phone on this side for, again, about the same price. Food, groceries, it depends what kind of food you eat and how expensive is your food taste, but 250 will be a decent budget. So you're looking at a total of 1,150. The greatest thing is about the UK is it's got free healthcare. So you do not pay for any hospital bills when you go to your doctor, when you get medication from the doctor or any kind of treatment, you do not have to pay at all, which is really, really great. And the healthcare system in the UK is amazing. My accent is South Africa. I've lived in the UK over 20 years, but I am really so impressed with the national health. You don't need medical insurance on this side, and every experience that I've had with the NHS has been just amazing. You do pay for eye tests, so that is not free. It's about £25 to have your eyes tested. And then if you are on chronic medication, every time that you go and pick up your medication, there is a pharmacy cost of £8.80 for the prescription. So that's all you pay, whether the value of the medication that you're picking up is £2,000 or £5,000 or £50, you only have to pay £5.50. So that is the cost of living. Now, relative. What will you be earning? So this will give you an idea of what you will be earning, so that you can see what will be in your pocket after your basic expenses have been covered. So there's a great website here, salarycalculator.co.uk. You can put in your salary, you can even put in an hourly rate there, and it will tell you exactly after taxes what you will be clearing. So that's a really good website for the guys that already have job offers to go and do your calculations here. So you can see here, if you are a young nurse with not a lot of experience and you are earning 24,000 per year, you will clear £1,663 after taxes. So if your basic expenses then is about 1,150, you can see that you still have about 500 and something left in your pocket to save or to send money home. If you are more experienced and you are offered £36,000, you will earn up to 343 after taxes. So this is just an example. You can have a look. Salaries are relative to comparing to where you live, in which area, in what field of nursing. So a very wide range is 24 to 36,000. And it is important to take in consideration that if I earn 36, but I live in London, my cost of living will be up to 50% higher. So just bear that in mind as well. And then what's also important is that you can feel comfortable that you will earn the same money as the British applicants, registered nurses in the UK. So in the UK, initially when you arrive, you're not going to be an NMC registered nurse. So you arrive here and then you still have to go and do your OSCE before you get your PIN number, your license to practice. So for that period, which is usually depending on your employer and the training program, but it will be anything between 6 and 12 weeks that you obtain your PIN. You have to get your PIN before 3 months. So within the first 3 months, you will definitely be moving up to a registered nurse salary. So initially employers pay lower. They call you a trainee nurse or a pre-registered nurse, only for the period while you are doing your OSCE training. As soon as you get your PIN, you get the same money as an NMC PIN nurse in the UK. Employers are quite transparent with their salaries. Most of the time it's advertised on their website. So you will know if you're earning the same money, and if you're not, call me. I'll put up a tantrum for you. So employers in the UK are generally very good with treating their overseas nurses the same way as the local applicants. And then another thing, just while I'm mentioning this, I've actually just done a study recently where we have 100 nurses that we placed in the UK, and within 12 months I wanted to see how many of them progressed into a more senior position, and within 12 months out of 100, 21 nurses were already in a senior position. So it depends on you. The opportunities to develop yourself are there, and about 21% of the nurses in my survey have actually taken on the opportunity. And now we've got many overseas nurses that are in management positions, hospital management, deputy management, and care home management. So we've definitely have a lot of success stories to share with you. You don't have to stay on that salary. Locations in the UK. So you've heard me talking about London. That's quite expensive. Here on my map, I'm not sure if you'll see my cursor, but we've got London here in the south. And then the closer that you are to London, the more expensive it is. I live here in Reading, and it is also quite a costly area. If you go a little bit more south and you go towards Southampton, it gets cheaper. Bristol is a great place, also cheaper. Plymouth is even more, a lower cost of living. And then this part is called here Birmingham, Leicester is called the Midlands. Things starts to definitely be cheaper there. And just so that you know, the UK is not a big country. To travel from Birmingham to London on the train, you're looking at about 2 hours. Hour and a half on a fast train. So it's really not far. You can live in Birmingham and still go visit your family for the weekend in London. So all of this from Manchester to London, you're looking at about just over 3 hours on the train. Same with Leeds there in a little bit more north. This area above Leeds usually have a lot of vacancies called the Northwest. Then you have Edinburgh, Scotland, Also great places to live, very cosmopolitan. We've got people from around the world living there, so you would definitely not feel isolated. And yeah, it's great places, good cost of living cities. Aberdeen is quite an expensive area, but the salaries in Aberdeen are almost the same than in London. Aberdeen, for some reason, it's where the oil is, and that is quite an upmarket place and really lovely place to live, but cost of living. So because Aberdeen is a higher cost of living, they've got a lot of wealthy people living up there, then the salaries are higher there. So everything always is relative. So don't always just look at the salary. You've got to look at the location, the cost of living in the area compared to the salary, relative. So Northern Ireland, to fly from Belfast to London, I do it very often for the day. I fly to Belfast in the morning and then back at 4 o'clock. It's an hour on the flight. There's flights leaving like almost every hour, and you will pay about £25 for a flight from Belfast to London. So if you live in Northern Ireland, cost of living is really good. The people are really lovely. We've got like a whole MMA community of nurses there. So we've got a lot of nurses in Northern Ireland. Last year we had about 400 nurses that settled in Northern Ireland. So you will also not be isolated. And I just wanted to mention that it's really, even though it's not on the mainland, it's really easy for you to get from Belfast to London. And there's also a ferry that you can take across to Liverpool from Belfast. And what expenses will be covered by your employer. This obviously also differ from employer to employer, but in general, the employers like to be quite competitive with that. And on the left-hand side is all the charges that you definitely wouldn't ever pay or pay back to the employer. So that is the skills surcharge. That is a charge that the UK government have implemented. And it's not only nursing, it's for all professions where they recruit people from other countries. So for every year that you work with your employer, they pay the government £1,000. The government then use that money to train local UK candidates. So it's a £3,000 fee that the employer have to pay for hiring you from overseas. They pay a sponsorship certificate, which is £199. They pay your visa application fee, which is also about £500. And they also pay for your OSCE training. So those are things that, and then MMA's fee, I should say. Employers pay MMA or all agencies, and that's why it's really important that you never pay any money to any agency. Make sure that you never get charged for recruitment. It is something that the employer pay. So they are sort of just outsourcing the international recruitment to a company like MMA, and therefore there shouldn't be any cost for you in that. The things that all employers will pay in advance for you, but some employers might deduct from your salary. And now you will know what they deduct and what they don't deduct, even at the stage of interview. So if you don't know this, please do ask, because it's important to also know what the employer is going to cover for you, so that there's no surprises when they start deducting money from your salary. Flight to the UK at the moment, most employers would not take that back. They would do a relocation agreement with you, where they say that if you leave us within 3 years, we've paid out all this money, we want you to pay some of the money back. So in general, your contracts with the employers will be a 3-year contract in which the relocation package will not need to be paid back. But some employers would say that if you leave sooner, we can charge you some of the money back. OSCE exams, quite a common thing for people to deduct, or for employers to deduct from salaries. Your OSCE exam is £794. That is part of your lifetime registration that you get. So once you pass your OSCE exam, they've already provided you for training, and they're happy to pay it in advance, but most employers will actually deduct that money back from your salary. And they do it over like 12 or 18 months, so you would hardly notice the money leaving your salary. So that's the one thing. Most employers will pay for you to travel to your OSCE exam center. There's only 3 exam centers, so you could potentially find yourself having to fly to an exam center depending on where you are based. So the employer will pay for that flight. They will pay for you to stay in a hotel the day before your exam, and in most cases that will not be deducted from your salary, but every employer is different. Most employers will pay for your first month of accommodation. Some employers even offer you a 2-week in a bed and breakfast, just so that you have more time to find permanent accommodation. My team will work with you from the beginning. Before you put your foot on the plane, we will have a plan for you about accommodation. And it's always a challenge, of course. It's really one of the biggest challenges when you arrive in the UK, to just manage your expectations, know where you are going to stay, and then also know that once you are here and settled, you will always be able to find a place that's perfect for you, but it might not be perfect in the beginning, because we often go for houses where you share houses with other healthcare professionals or other nurses, but after a few months in the UK, you rather want to get your own flat and stay on your own. It's not everybody that can share a house. So a first month of accommodation is usually covered by employers and sometimes deducted back, but very often that will be part of the relocation that they pay for you. The deposit for your accommodation, now, like I'm sure in your home country as well, if you move into a permanent place, you usually pay a deposit. So the deposit can be 1 month the rent or 2 months the rent, and you get that back when you move out of your accommodation. So for that reason, most employers don't pay for your deposit. I mean, they do pay, but they will deduct it back from your salary. So all of these expenses that you see there, you don't have to worry about paying that in advance, because the employer obviously understands that you come from a lower currency and that you don't have so many savings to pay all of this at once. So they are always happy to pay this for you. And then if it's part of their relocation to deduct it back, they will make that arrangement with you. Some employers even will pay for your IELTS and CBT. So when you start with them, you just have to give them your IELTS receipt, and with your first or second salary, they give you a refund. So that's sometimes also really good to get. And you will see this in the relocation package. And then after you pass your OSCE, there's a fee of £153. That's your final registration fee that you pay to the NMC. Employers will be happy to assist you with that. And they either deduct it back from your salary, or it will be part of that clause that if you leave us in 3 years, then you will pay that back to the company. Now, can I bring my family? I'll just need to take a breath. And the good news is, yes, you can bring your family. You can even bring your unmarried partner. So if you have proof that you've been in a relationship for more than 2 years, you can bring your partner. And you can bring children under the age of 18 years. Your wife or your partner gets what we call a dependency visa, and they can work for any employer in the UK. So that's really great. And on 2 salaries, it is really a great place in the UK to live, and you will have more than enough money to have great holidays and not have to struggle. If you bring your children as a single mother, you've got to think about your expenses, because it's really expensive childcare. If your children is under the age of 3 years, it's extremely expensive. You can bring your parents or families, nieces and cousins to help you with the kids, and they can stay on a tourist visa for 6 months and living with you if that's something that you want to explore, or just communicate with my team or our team, and we will make sure that we connect you with other single mothers so that you can maybe communicate and share childcare and work like opposite shifts or something. There's always a way around this, but I just want to make you aware. We always advise our nurses to travel in the beginning on their own. The nurses that follow that advice afterwards say, we're glad we did, because it's really much easier. Remember, your first 6 weeks in the UK is really OSCE training, because they've got to focus on getting you trained for your OSCE. And very often the OSCE training center is not at the facility where you are working. You have to travel and commute to training centers, sometimes stay there for a week. And this is difficult if you've got the whole family. For example, if the training center is at the head office in Northern Ireland and you are based in mainland England, then you have to fly up and down and stay in Northern Ireland. And now where's your family if you are traveling? So it gets really complicated. And also it takes your focus away from focusing on just getting this OSCE information in your head. So you've got your husband to worry with, the kids at school. So in the first at least 6 weeks, I would really recommend come on your own, get the OSCE, get your head in the game, focus on the training for the OSCE. And then as soon as you get your PIN, you're moving to the higher salary, so it's much easier anyway then. And then you can start planning. Now you've got the OSCE out of the way, you can start going to schools, talk to the schools. You can start looking at job opportunities for your husband maybe, or your wife. And that is really going to be so much better experience for you to then get the family over. And just think about that day when you go to the airport to meet them, and you've got everything sorted out. You've got the house and the school and the kids, and everybody is happy, because with the family right from the first day, things get stressful. Yeah, so definitely that's my advice. Absence make the heart grow fonder. So if it's only a few weeks and you know it's in the best interest of the kids or of the whole family, then really think about coming on your own first for a few weeks. We have many nurses who then fly home to go and get the kids after 6 or 8 weeks. And that's definitely possible, and now you've got UK pounds, and things are just much easier to do it that way. We can assist you with this. We are not immigration advisors, but we've done it for so many nurses, so we'll definitely be able, unless you've got a very complicated situation, we'll be able to just point you in the right direction with the application forms, etc. So any questions? I will now stop the video for the recording purposes, but I would love for all of you to stay on and share your questions with me. Thanks again for listening. I hope I wasn't talking too fast. Bye.